Arbeiter Samariter Bund, the Workers Samaritan Federation, is a German aid and welfare organization engaged in areas such as civil protection, rescue and social welfare services. As a non-political and non-denominational organization, ASB has, since its foundation in 1888, represented continuity and reliability. On November 4, 1921, ASB's first humanitarian aid mission abroad began, saving people from starvation in Russia. Today, after 100 years of foreign aid department existence, there are many important milestones to remember, such as aid in Balkans in the 90s, the mission in September 2004 after the tsunami in Southeast Asia, and the severe earthquake in Haiti in January 2010. With first aid supplies and Samaritans with equipment who traveled from Germany to the affected regions, the ASB country offices abroad and the cooperation with the local partners were established over the years. Today, ASB is active in around 30 countries. It provides people in Haiti with clean drinking water, trains people in Indonesia in disaster preparedness or provides medical care in Mongolia. Since its inception, ASB Foreign Aid has focused on three main areas: the inclusion of vulnerable groups, those in particular need of assistance, helping people to help themselves, and the sustainable fight against poverty. With a devoted team of around 400 people in 27 countries, every year, ASB Foreign Aid Department implements 190 projects with average annual value of €25 million. After the breakup of Yugoslavia in 1991 and the beginning of the Yugoslav Wars, the ASB launched one of its longest humanitarian aid missions abroad. The ASB helped refugees, set up outpatient medical facilities and organized aid convoys. The first humanitarian convoys that went to the besieged city of Mostar in Bosnia and Herzegovina in 1992 bore the logo of the ASB. Since then, the ASB has implemented nearly 400 humanitarian and development projects in the Balkans with a total volume of €190 million. After the war, the ASB assisted with the reconstruction of power grids, bridges, water supplies, schools, kindergartens. Through the reconstruction projects, around 16,000 houses, apartment buildings, public institutions and hospitals in 237 communities in Southeast Europe were repaired or rebuilt. With the help of ASB offices in Southeast Europe, more than 1,000 refugee families and internally displaced people from former Yugoslavia had returned to their homes. ASB was there continuously from the beginning, helping people and local governments develop the socio-economic model that will work best and helping bringing countries devastated by war back to the high-functioning state. Through projects of socio-economic empowerment, ASB had donated more than 500 greenhouses with agro training and additional equipment, helping most vulnerable families, schools and homes for elderly grow their own food and increase their income by selling the surplus. Vulnerable individuals, minorities and returnees had received help in socio-economic grants in form of tools and machines for carrying out their own professions, as well as business startup and vocational educational trainings for those who were in need of education. Tens of thousands of children, youth and adults had visited educational, psychosocial and creative workshops led by teachers, trainers and psychologists. Through grant scheme, more than 500 mine victims were assisted with income-generating grants in order to start their own businesses and provide for themselves and their families. ASB had also helped to better connect and strengthen the public, private and civil sector by providing training for government employees as well as players in the private and civil sector. The training included continuing education courses on topics such as accounting, taxation or starting up businesses. With a permanent staff of 25 people and a national partner support staff of 75, ASB is present and reliable partner in emergency disasters such as floods, earthquakes and refugee crises. ASB had helped more than 6,000 flood-affected citizens receive reconstruction of their damaged and destroyed homes. 360 flood-affected enterprises and agricultural producers were able to revitalize their businesses' activity with the received grants. During the refugee crisis, more than 60,000 refugees and migrants on the Balkan route had received food, hygiene and clothes, while 20,000 persons were sheltered in refugee centers constructed and equipped by ASB. The ASB relief efforts in Balkans always focus on vulnerable people, such as people with disabilities or marginalized groups. The ASB has been engaged in projects for return and reintegration, the socio-economic inclusion, the strengthening of civil society in Southeast Europe, the integration of Roma, and the promotion of Samaritan cooperation at the local level. Through IRIS network, created to ensure the social inclusion by enabling the environment for the provision of high-quality services, more than 250 providers of social services for 10,000 individuals per day were empowered, trained and supported in a period of 10 years. More than 3,000 individuals from civil and government sectors in Bosnia and Herzegovina, Serbia, Albania, Kosovo, Montenegro and North Macedonia were trained, and more than 60 local action plans were developed. Through continuous support to vulnerable minorities, 10,000 Roma persons now live in new or reconstructed homes by ASB, while hundreds of adult Roma underwent the educational training and had joined the labor market. In 2018, the Social Dimension Initiative was created in order to enhance the dialogue between the civil sector, citizens and political elites, both in EU and the West Balkan countries, on the necessity of the social dimension of the EU integration for the West Balkan countries, while additionally promoting high values of the Union and tangible benefits for the accession. Through this initiative, 65 municipalities in 6 countries were supported in project development, 6 memorandums of understanding and 1 regional social dimension declaration had been signed. 195 project proposals were created and 12 municipalities financially awarded. ASB team members were on the field together with medical workers during the peak of COVID-19 pandemic, supporting hospitals and isolation units by donating valuable medical equipment, beds, medicine, masks and other supplies. In the aftermath of the highest danger, ASB team had focused their efforts on promotion of vaccination in rural areas, helping elderly reach doctors and healthcare centers, but also on helping school children compensate lost school lessons during the lockdown by providing educational workshops. Through donations of European Commission and international donors such as governments of Germany, United States, Netherlands, Belgium, Austria, Sweden, Norway, as well as regional governments of Croatia, Bosnia and Herzegovina, Serbia, Kosovo, and other private donations from citizens and its own fund, ASB South East Europe team is able to help where help is needed the most for past 30 years. The ASB long-standing presence in the region has led to close and effective cooperation as well as open dialogue with national, regional and local authorities in the Balkans. Well embedded and working closely with the government decision makers and the civil society, the ASB has become a major player in the region when it comes to providing socio-economic assistance to people in need. The ASB offices in the Balkans regard this as a commitment to continue promoting results-driven, innovative ideas and initiatives. This may also contribute to the Western Balkan countries joining the EU at some point in the future. Until then, we continue to help here and now.